So, welcome all of you to this special episode on Hanuman's birthday and World Homeopathy Day. Today is a very special day for all of us because the father of homeopathy is born today in 1755, and we have kept this special session with an amazing homeopath, amazing physician, Dr. Jaswant Patil. So this is a special tea break diary which is happening on Sunday. Generally, we do it on Wednesday evening, but this is a very special day and special season, and we have a very special guest. So let's take him first, and then we will go ahead. Thank you so much for joining. Please share this with your friends and colleagues so that they can also know amazing journey of this wonderful homeopath. Yes, sir. Sir, good evening again. Can you see me and hear me?
Yeah, I can see you. Can you see me?
Yes, sir. Yes, sir. Perfect.
I think we are live now. Very good evening and
Yes.
special day celebration of the birth anniversary of the great doctor,
Yes.
teacher, and founder of homeopathy, Dr. Hahnemann. He was a great doctor in allopathy also. And later on, he was a founder of homeopathy.
Yes.
Many of the people do not know this fact. And I was also not knowing.
Yes.
But he was a scholar in allopathy with a very high scholastic performance, and he was the son of a potter, if I am not wrong. And he was
Yes, that's
asked
true.
by his father not to study, to help in his business. And when the teachers came, he is a
Yes.
brilliant student. So he said, I do not have funds. And the teachers supported him. And then he could take his lessons. And then he went into the medical school, and he was a topper there, even in the medical school. And later on, that time, even allopathy was not that far advanced that is today. Today's modern science
Yes.
is 1,000 times better than the allopathic science in those times, because that time bloodletting was the treatment, which is not there in nowadays in
Yes.
modern
Yes.
science. So that science has grown from that to the biggest level. And that time he said that people are dying more by bloodletting than by the disease, and therefore he shunned his practice, and he was he knew 13 languages, and he was trying to translate the different materia medica, different medical books into the other languages. And there he found out that the cinchona bark decoction, he tried after reading some books, and then it produced the same symptoms as malaria. And when he gave the same medicine to malaria patient, that patient responded to malaria. I don't remember exactly what was the time when quinine was discovered. Now today cinchona is used for malaria even in allopathy. Now you see the similarity. Here it is given in material doses. There also he had given in material doses in the mother tincture form. So, it was given to the normal healthy subject. Here it was tried on the patients.
Yes.
But even allopathic drugs are studied by giving healthy volunteers the drug and seeing the physiological changes in the body. And in one such trial, I was, as a medical student, I joined one trial of the drug in MBBS in JJ Hospital. There we found that it was how the medical allopathic drugs are researched. So, in short, to tell you that Dr. Hahnemann found out that the drug that produces the disease, the same cure the person in that disease. So person in the disease get cured. So it was a great discovery. But anyway, someone who discovers something in the start is always haunted. And he was haunted. And how difficult life he had gone through, resistance, rejection, and what not was done to him. Even he was expelled from the country, and it was declared as a witch science because it didn't have a basis. Now there is a basis because it shows the result. Now it is a job of a scientist to prove what is the basis. It's like a wonder of the world. We do not know about the wonder of the world. What is the basis? Even today, we say, therefore, it is a wonder of the world. But he found out, and so many people just started getting better. So there is always, if you go on a Wikipedia, it said that it is a placebo. So my
Yes.
argument for that, or justification for that, is okay, all right, you say placebo. If people are getting well with a placebo, why give a material drugs? The final aim of any doctor
Very true.
is to cure the sick. And if the patient is getting well
Yes.
with placebo, why not? And with placebo, simple diseases, psychosomatic diseases, common cold, which has got, there are 80% of the diseases are self-limiting. It is given in allopathic books also when I studied my allopathy. So 80% diseases don't require a doctor in the real sense. So take it one argument that 80% get well, so you give placebo or drug, anyway they are going to get well. But what about those 20% which are serious diseases? And if they get well with homeopathy, then we cannot call that as placebo. That is what is the justification.
Yes.
First, I would like to give, because these are the two big things that I have seen. And secondly, homeopathy has got steroids. That is another myth. These two things are commonly been talked about. If it has steroid, when the patients have taken steroids in allopathy and they come to a homeopath, and if they get well, so homeopathic steroids are not different. First of all, there is no steroids in homeopathy.
Yes.
But even for your satisfaction,
Yes.
if we say, okay, we assume. But what about your steroids have not given the result? So which steroids? Ultimately, there are some quacks, it's in everything, where they use steroids in a wrong way. Not a standard homeopath or a standard Ayurvedic doctor practices this. But even in Ayurvedic science, many people put that blame that they mix steroids in it. But I don't think a standard doctor would ever do that. And it has been commonly blamed. So,
Right. Very
to
true.
come to the point, Dr. Hahnemann has discovered such a great science with the curative power with no side effects. That was the greatest discovery. So, first is a great tribute to him, and today is his birth anniversary. So, we always salute him and respect him. And the second thing that I would like to say on his behalf is that I always feel he comes and tells me, you have not grown from where I have left you. You're not
Very
grown
true.
from
Very
where
true.
I have left you. Allopathy has grown from where the allopathy was left at my time. From bloodletting to, no doubt now the allopathic science is advanced. I respect that allopathic science because
Yes.
it has taught me a lot of things in depth about disease, diagnosis, physiology, anatomy. That was a perfectly taught treatment part, ICU part, surgical part. Nothing can replace that. There is no question about it. ICU part. Every many homeopaths, they require allopathic treatment. Allopaths require homeopathic treatment. So there should be no fight between allopaths and homeopaths, because all of us are doctors born to cure the sick. The mission of physician,
Yes.
Dr. Harriman said, is to cure the sick. And therefore, we pray today for his great ascension wherever he is, and may God rest his soul at peace in heaven. Thank you. And if you have any questions, you can ask me.
Yes, sir. Surely. I'm going to ask you so many questions which we have already in mind, and we have also collected from the audiences because they wanted to know about your journey into homeopathy and so many other things. But before that, I really want to thank you from all of us and with all my heart to accept because you accepted this invitation. And I just wanted to say that you also have that similarity, just like Hanuman. And that's why I wanted to do this episode today with you, because you are also an allopath turned homeopath. And, there's so much which you have given to the homeopathy community as well. You have taught a lot. And I wanted to tell you that my whole family, especially my
Oh,
maternal family, is your patient. And I was also your patient up to 3 years of age
oh,
when I was in 𝐸𝐴𝐽. So it is, I have taken your treatment, your services, and I have also seen how you practice and, all those things. So I'm really thankful that you accepted this invitation from Homeopathy Junction. And a lot of people are very excited, especially students. They are actually, commenting, if you can see that. So guys, though I know that Dr. Patil doesn't need any introduction, he's so well known, but still it's my job, so I'm going to give a little introduction about himself today. So, sir, first of all, welcome to Break Diaries. We do these kind of interviews with different homeopaths who are senior and who have experienced a lot, and we try to learn from their life lessons and their journey into medical practice. So thank you. And guys, Dr. Jaswant Patil is MBBS MD Chest from Mumbai, and he has also completed his BHMS from 𝐬𝐴𝐽𝐻 College, and now he's practicing homeopathy from more than last 20 years, and he's practicing into medicine from more than last 35 years. So he has a great experience of treating various kind of diseases. He has 4 clinics all over India, that's in Nashik, Pune, Mumbai, and 𝐸𝐴𝐽𝐻. And he has done a lot of diploma courses also. He is a teacher, he's a researcher, he's a creative thinker, and he's an amazing practitioner. So I just want to name few of them, because if I talk about him and his achievements, it will take 1 hour to list everything. So he has done his fellowship course in medical yoga from Maharashtra University of Health Sciences Nashik. Then he has completed his course in alternative medicine, certificate course in medical astrology, practical training of meridian corrections therapy, certificate course in Reiki, certificate course in diet therapy, and he has also done certificate course in clinical research solutions. And like I said, he's a researcher, speaker, teacher, and practicing physician. And one big achievement which happened recently is he was appointed by Government of Maharashtra on Ayush Task Force Committee on 2nd of May 2020 to advise government on the problem of COVID-19 prevention and treatment. And if you go to his Facebook page, you will see a lot of updates related to COVID-19. And so when you were appointed as a committee member, that was a great hope for all homeopaths, because you have expertise in both the things, homeopathy as well as pulmonary medicine. So we were actually looking forward to your post and your contributions, and that was really commendable. So that happened in 2020, and sir has treated a lot of COVID patients, and he has also advised government that how both things can be integrated together and treated. And he has a long experience. He was a resident doctor in Jasloke Hospital in 80s by 83 to 84. Then he was in KM Hospital. Then he was in R.N. Cooper Hospital, Mumbai. He was also in Hanuman College of Homeopathy, United Kingdom, as a mentor and PG guide from 2013 to 2015. And he's a founder and chief and director of Deep Ganga Nursing Home and ICU 𝐸𝐴𝐽𝐻 and Mumbai and other places also. So welcome. And we want to ask you one question, that how was your journey into homeopathy? How did you become a homeopath? This is one
thank you
question
so
we all
much.
want to know.
To-
You're most welcome, sir. It's a
Today,
pleasure to have you.
I was supposed to be in 𝐸𝐴𝐽𝐻 because from the college where I passed my
Okay.
BHMS, whole of the 𝐸𝐴𝐽𝐻 district Homeopathic Doctors Association had gathered, and my reservation was already made. And today's interview that I am doing from Mumbai, I was going to do from 𝐸𝐴𝐽𝐻. But fortunately or unfortunately,
Okay.
I developed a high-grade fever. That was day
Oh,
before yesterday night. In the evening, I was
okay. Sir, sorry.
Yeah, it was very difficult.
Yeah, actually, we have lost your voice, but now you're audible.
So from there, it was very difficult for me to get up from my bed also. I was totally down with 102.5 fever continuously. The whole day, it was next day, whole day it was
My God.
102.5. Difficult situation for me, and I had gone into a delirium. And today I am speaking to you. Do you find anything on my face? No
My
one would
God.
believe. It is because of
No,
homeopathy. And
nothing.
that too, it was difficult for me
Wow.
to prescribe myself the medicine. But my daughter, she is an MBBS doctor, and she is preparing herself for a post-graduation in medicine in allopathy. And I had taught her. All of my family members, and the near relatives, I treat with homeopathy. But something goes wrong with me. Who will treat me? Because my ideas are a little different. I am a very aggressive physician. I cannot just give the medicine and relax and see tomorrow. No. Therefore, I had told her, given tips, something goes wrong with me. These are my medicines. So she had given me 5-6 homeopathic remedies, and nothing was working.
Okay.
Finally, I went into a delirium, and she was saying, "Papa, get up." And my oxygen dropped down to 92. And I do not know what it was, but she gave me tuberculinum 30. And I was
Okay.
little bit better. Then she gave me tuberculinum 1M in a span of 15-20 minutes. And I started sweating and my fever broke. And 3 o'clock at night, she also slept, I also slept. In the morning, it was 101 for 2-3 hours. Then it came down to 100. And then I was fine. That was the story of yesterday. And
My God.
I asked her, how did you prescribe me tuberculinum? She said, Papa, you said when the real indicated remedies are not working in fever, give tuberculinum. So I asked her,
Oh, wow.
how did you select potencies? I said, I was afraid, so I gave you 30. And after that, you were not responding so well, so I gave you 1M. I said, why not 200? So it was not there in the bottle. The bottle was not available at home. I said, okay. But I said, you can be a good homeopath, but first become an allopath, because the real teaching of the science, human anatomy, physiology, everything, what is there in allopathy, it's the best. And that is how the homeopathy is. She will take an experience from me. I never force my children what they want to be. That's their choice. I was an allopath and who was strongly against homeopathy. And that particular thing was bothering me when I started believing homeopathy. It was a fact that I used to shout on my patients if they used to come in my ICU after taking homeopathy, or come in my OPD after taking homeopathy. You people spoil your health and then come to us at a very late stage, and this and that and that and that. But one day, fine, in my home, my mother fell sick and she was on a deathbed in my own ICU. It's a long story, so I'll cut it short. And she was not responding, multi-organ failures, no pulse, BP, everything. And I asked that time homeopaths, but no one was daring, because she was my mother and something goes wrong. If you give homeopathy, something goes wrong, everybody is afraid. But nothing goes wrong. Homeopathy, I have seen, either it works or it will not work if the medicine is not selected right. It will never do harm. That is my personal experience. I do not know about others, but I have practiced homeopathy even in ICU. And then no one was helping me out. So one friend of mine had given me a book of homeopathy. That was Dr. Kent. I used to open it, read it 1 or 2 pages, and then close it. It is not going in my head because standard protocols are there in allopathy. Here there is no protocols. Everything is stocked
Yes.
in one drug, so it was not befitting my mind. So what I did, I just prayed God कि I'm in a checkmate position. I left my appointment of Hinduja Hospital. I was welcomed there as a chest physician. I hadn't planned to go to US for my further super specialization ahead of pulmonology. And my mother was sick, so I came back. She said, I want you with me. For all these days, 12 years you are away from me. I do not know how many days are remaining, and I cannot miss you now. So I had to start my clinic in 𝐬𝐴. There was no choice. So she was dying. I said, I came for you and you are leaving me. What's the use? So I prayed God and opened up a book, and suddenly iode only came first. It was just by a fluke. I read that whole of the Kent's explanation on ars iode, and she was exactly fitting in because she landed into complications from tuberculosis to hemoptysis to septic shock and everything like that. And I was not knowing how to give. So I asked her, I have got one remedy. You tell me how to give and from where to procure. So he was my relative in Banaras. He's also an MBBS and he's practicing homeopathy, Dr. 𝐕𝐵𝐺𝐬 from Banaras. He's my younger brother's father-in-law and well-known homeopath in Banaras. So he said, you do one thing, get these globules, put it in a cup of water, just stir it well and give 1 teaspoonful. I said, such a small dose, how can? She is so serious. I'll give only once. I said, okay, I'll give once.
Yes.
And with that, I started seeing improvement, and 24 hours, there was a magical improvement. 48 hours, she was out of all gadgets, and 72 hours, she was asking for food, and as if she was not that serious. 5 years I have worked in ICU.
Great.
IRCO, Intensive Respiratory Care Unit, ITCU, Intensive Tetanus Care Unit, ICCU, ICU, IRCU, Intensive Respiratory Care Unit, and Intensive Medical Care Unit in KM. All these my intensive job, I have not seen a recovery like this. And that was so fast. So that gave me a confidence कि साइंस में दम है. पता नहीं अपने को इस साइंस के बारे में, पर इस साइंस में दम जरूर है ना. I should explore this science. From that day onward, I asked a homeopath, get me all the medicines of homeopathy. And I had one book in the Reader's Digest by Dr. Tandon. It was giving diagnosis and homeopathic medicines and characteristic symptoms, how to select. So I started my integrated practice first. I employed a homeopath as my assistant and said, whatever I choose, just guide me if I'm wrong. He said, sir, you are doing the best. I said, still, you be there so that, I'm always be sure about what is going on. And 1 dose of homeopathy, 1 single dose of homeopathy and full prescription of allopathy. So like in asthma, I used to give minimum 10 drugs because side effects, antacids, then sleep is not the sleeping pills and everything. So 10, 12 drugs and a single dose of homeopathy. But I used to feel ashamed of giving homeopathy. Let me be very frank with you. Because it was that thing in my mind. Kya homeopathy kya dete hai? So I used to give it in water. Dissolve the content in water and give it to the patient. So patient used to say, sir, I'm getting so good relief with this. I said, with what? I said, water में जो देते हो ना, घर जाते जाते मेरा chest clear हो जाता है. So my OPD started increasing and indoor started decreasing. And in ICU, I started getting wonderful response to the patients. So I asked one patient who was asthma, every weather change is to get admitted. For 1 year, you have not got admitted. Why? Sir, what you started giving that water dose, now I am your patient for last 5-6 years. As a pulmonologist, used to come to me. I used to prescribe steroid inhalations, saline inhalation, and all that. And this whole year you didn't come. Only the day you started giving that water medicines, no, my asthma is almost gone. Now you prescribe me, but I don't bring it. My one pump is going for six months. I take only when it is required.
Wow.
Then I got a confidence. Yeah, I'm doing right practice of homeopathy. I was not knowing principles of homeopathy. I was not knowing anything about homeopathy, but clinically I used to go. Then I started reducing my prescriptions of allopathy and giving homeopathic remedies with more confidence. Even to that extent in ICU, I'll share one experience. A case of complete heart block in a myocardial infarction. He was an old person, I think 70-year-old, the hyperacute changes with a complete heart block. At whole of the Khandesh, I was the only person who was putting a pacemaker in the heart in myocardial infarction. So I said, see, that time it used to cost almost around 50,000 rupees with urokinase, streptokinase and pacemaker implantation. So the relatives said, we can't afford such expensive treatment. And they ran away. Patient was in my ICU. No one was bringing even the basic drugs. They said, at least give me streptokinase to be lake do. Nothing. So they ran away. I had what to do now. So I thought, now this is the time I should use homeopathy. So I used arnica, cactus G, these two drugs. Because I had learned that arnica dissolves clot. That was I was knowing. And arnica cures the ischemic injury from the allopathic point of view. There was no repertorization or characteristic symptoms. And I gave arnica one single dose and cactus G in 6 potency repeated. And that time I used to go to another place for practice, which was around, say, 40 kilometers away. So I told my assistant, who was managing ICU in my absence, I don't think this person will survive because we are not doing anything except for dopamine drip. And that too, his BP is not coming up with dopamine drip. And the people are not bringing any medications. So we have no choice. I have given homeopathy, but I do not know whether he will respond or not, because I am not very well versed with homeopathy. I went there and came back and saw this person sitting on the bed and eating food. I said, what happened? I got my ECG machine, immediately took an ECG. The hyperacute changes of the ST segment in acute myocardial infarction came to isoelectric.
Amazing.
And
Wow.
the ECG was so normal as if that patient didn't, and the complete heart block disappeared. So it was big surprise for me. So I said, you preserve this ECG, otherwise this normal ECG, someone says, they will say, अरे तेको heart attack नहीं आया था, doctor ने उल्लू बनाया. So I took those two things and pasted on one paper. This was this and this. So I, that time, realized that the homeopathic urokinase is arnica, which is costing few rupees. And that time urokinase used to cost 20,000 rupees. In 1995. I don't remember the exact year, but around that. And streptokinase used to cost 10,000 rupees for giving for acute heart attack. And that again increased my, so my practice started increasing. Then a lot of complaint used to go, okay, how allopath is practicing homeopathy. I said, so many homeopaths practice allopathy, no one is bothered. Why they are bothered for me? So then I decided I should do a complete homeopathic course. I took an admission, in Chamunda Mata Homeopathic Medical College, Jalgaon. The proprietors of that were very kind enough to give me that admission, and they did all the procedures. And I appeared for all, right from anatomy, physiology, again in the paper. So when I used to go in the hall, there I used to go and see, and whenever I used to enter, students used to stand. They used to say, examiner aaya hai. I used to say, I am also a student, sit down. And I used to write anatomy, physiology papers. So I was remembering my MBBS, same papers were same, almost the course is same except for the medicine part. Otherwise, BHMS part training is exactly like MBBS, only the practical training that is lacking, that needs to be improved. So while appearing for the exam, student came. I asked, she was a girl, कि what happened to you? Sir, मुझे कल गाड़ी ने उड़ा दिया था. So I went, I am taking Combiflam, ये बहुत सारी चीज. मैंने कहा, you are appearing for homeopathy, you didn't take homeopathy. बोले, no sir, we don't have any belief. I said, if you don't have belief, why you are into the college and why you are getting into homeopathy? So no one gave us the confidence. That is a sad part of the story. I said, you do one thing. You take arnica, ruta, hypericum. Now nerve damage is there, tissue damage is there, and so all three combinations. Don't take at a time, but take at 1 hour's interval and repeat it. And next day she came, she was walking without a pain. I said, this is homeopathy. And I am allopath, I am into homeopathy because the effect of this. So our students needs to be taught and shown what are the powers of homeopathy. That is, till that time we give confidence to our students who are learning homeopathy. They will not come into homeopathy until the time we make it simple, homeopathy in a simple way. Because it was really a big problem for me. There were a lot of assumptions. When I learned BHMS, after 17 years of my MD chest, so the gap of 17 years, I became again a student. I knew what difficulty it was, what students are facing. So I am very well versed with the problems of homeopathic students because I was one of them. And they said, then why you are learning? Because we'll get a degree and we'll practice allopathy. So I said, this is that is a sad part.
That's a sad part.
For that, they are not responsible. We are responsible as a teachers and we must do something. That time I thought, although homeopathy should be made simple, not a complicated one, where students should reach at least for the basic management with simple tips so that they gain confidence at a lower level and then they start ascending high. And gradually I became a classical homeopath. One single remedy, not to be repeated. Then I started getting results. But if you see the success of result, percentage, if you treat 10 patients, you may get amazing result in 2 or 3. But what about 8? They get partial result, some get no result. So the success depends on what is the percentage of the success. So if suppose I have cured so many cases of cancer and I can show you minimum 1,000 cases, very rare cases which has been effectively treated and there are good results pre and post with photographs, CT scan, the cancer reduced even without chemotherapy. But that doesn't happen in all the patients. Let us be very frank and true. I said I have got the results, amazing result. That doesn't mean I can cure all or treat all. And the students also should limitations and scope of the science, where what is to be done, when the integration has to be done, when you should be saying no, only do this. All this has to be well defined and well formulated in homeopathy. And this is a point where the students needs to gain the confidence. That is how I got a confidence in homeopathy. Then I came to know about principles, organon, what this aphorism means, that aphorism means. Dr. Hahnemann has clearly said about the journey of the disease and how the disease behaves in aphorisms. In a simple way, not to make it complicated. Then I said, I am not practicing as per Dr. Hahnemann's principles. Then I started practicing. But many places, I would say, there was a confusion about individualized remedy. Individualized remedy is it was a confusion. So I said, I myself tried 5 different homeopaths and they gave the remedy. And that was not matching to each other. Then which remedy is correct? So then individualized, like you go in allopathy with a fever, every doctor will prescribe paracetamol. What is there in homeopathy? It's not there. So there has to be a proper format. whereby one can be very sure. Otherwise, if you give, like it happened in me yesterday, my daughter could treat me because she followed the basic principles. And I told her, because in my practice, I've seen serious patient. If I give a wrong remedy, wrong means not well selected remedy, either it will act or it will not act.
Yes.
When it will,
True.
why it will not act? Because in proving it acts. That proving is on healthy subjects, not on the disease subjects, right? So the dynamics is busy with the disease force. It will not show the symptoms of the remedy given. So it will be aborted. The mission is aborted of
True.
showing the. So that principle, that particular thing fit into my mind. And it came to my final conclusion that yes, because I read in Dr. Hahnemann's principles only. I don't remember the book which was analyzed by some other author. He said there is a zigzag treatment. You start with whatever you see and keep on changing as the symptoms they change. And finally, a vital force will give you one characteristic symptom. You hit with that remedy and the patient is okay.
Yes.
For that, what you need is to see
Right.
every week rather than seeing after a month. That is a wrong practice. I am telling my experience.
Yes.
So my homeopath friends, colleagues, students, and I'm always sharing what I feel. I may be wrong, but what I have experienced and what I am learned, I am putting in front of you. Because many a times it used to take my confidence away. Oh, I cannot practice this type of homeopathy, so I'm not a good homeopath. But results
Yes.
in incurable cases was a thing that always hurt me. What is this incurable? And this incurable cases, I used to treat with homeopathy in a zigzag manner with multiple drugs placed at 1 hour, 2 hour, 2 day, 3 day, depending on the severity. And I used to get results. This I learned from one case where I failed. And that patient left me. He went to some doctor in Bhiwandi. I do not know his name exactly. That doctor gave him minimum 10 mother tinctures to be mixed, 10 drops, and 6-7 remedies to be taken at 1 hour interval. He was with multiple metastases and everything. He came back to me, all ascites gone, everything gone, and he's fine. And he came and showed me, sir, see, I'm fine. I felt, I was feeling sad because I failed there. Then I said, what he gave, let me see. I said, he's given so many, this is wrong homeopathy. Sir, wrong homeopathy, right homeopathy, I do not know, but I am saved. So what is the right homeopathy when you save someone? And that is how Dr. Hahnemann also changed. So from first edition to sixth edition, he has changed. But after sixth edition, there is no addition. And there we have to think and take homeopathy ahead with the modern times and modern science. That is what is my aim. This is in short about my journey to homeopathy. I think I covered many things. You must be having multiple questions. So you can ask the next question.
Yes. Definitely, it was wonderful to know your journey, sir. And truly, whatever you said, I totally agree. And you know, there is a footnote by Hahnemann and Organon where he also said that you need series of remedies to be able to cure the patient. So whenever you know this whole thing controversy about single remedy, single dose, classical, non-classical goes on and on and on. But yes, Hahnemann himself said that you might need different remedies at different stages to be able to cure the patient. So that's very true, and I have seen that you're doing a lot of work for cancer patients in recent times. I saw in your website, so that's really wonderful. And of course, like you said, that so many incurable pathologies, we should do something about that. So that's a great area to research for homeopaths as well, because yes, the the percentage of success could be even better than what we are achieving right now. Sir, I want to ask you that what was your struggle? What was that thing which which you think that it was really bothersome in your journey, being coming into homeopathy from a allopathic background? So what struggles you had in your journey, and how did you overcome that? Because we have a lot of young audience, a lot of young practitioners, and they also they would like homeopathy as "Arey baap re, kaise hoga?" So it
Yeah,
would be
yeah, I
nice
had a
thing
lot of
to know
trouble.
about
I,
that.
I had a lot of
How to
trouble.
overcome.
Even I had to go to police station to give the statement that I am not practicing homeopathy.
Oh.
I said I'm not practicing. The assistant in my hospital clinic, he is a homeopath. I'm just taking his advice along with my allopathic prescription you give. That was the biggest thing that I have faced in my life. And when in my nursing home and everything was built up, and I was a physician there with an ICU, with the advanced fiber optic bronchoscopy, computerized ICU management, telemedicine that time, even with states and that we were doing that time.
Yeah.
And pacemaker implantation, temporary pacemaker implantation, and I was to start the cath lab for angiographies and angioplasties. I was trained in Jaswant Hospital for that. So I was a pulmonologist as well as cardiologist because I had done extra posts. Normally, usually when you finish MD, so I got 1 year late admission to the MD because I was not getting a branch of my choice. So I had preferred to wait in that. I had done in cardiology, general medicine, nephrology, hematology, all these 4 branches and different ICUs. And then I got into respiratory care unit. Then I was there as a pure. Then after that, after finishing my pulmonology, then I worked as a cardiology registrar in Cooper Hospital, and I was managing ICU. So, after so much of big journey and coming and having a well-reputed nursing home, when I expressed my desire to my father that I may change my branch, see, he said, "Why you want to change? You do the integrated practice." I said, "I can do the integrated practice, but what results I am getting with homeopathy? Now, many times nowadays, I find I don't have to give allopathic medicines also along with that prescription. I was giving out of fear that whether I am prescribing right, patient will not get well or no. But I want to be a homeopath." He said, "You know what will happen? Now you are earning 100 rupees. After homeopathy, you will earn 10 rupees. Can you survive on 10 rupees?" My allopathic colleagues, who is no more now, and his nursing home was next to me. So we were managing each other's nursing home in our absence. So he said, "अरे जसवंत, तेरा दिमाग खराब हो गया है क्या? होम्योपैथी करेगा तू?" मैंने कहा, "Boss, I started loving this science. It's giving me amazing results. And what pleasure you get in curing someone, you cannot get that pleasure in just earning money. Money everyone requires. My fees were very less earlier, very, very less. Now it is more because I have to stand by with my research and everything, background and everything. But definitely it affected me. And my father said, "You go to any function and say, I'm cardiologist, I'm a pulmonologist. People will make you sit in the front. If you say, I'm a homeopath, he'll say, piche baith jao." I said, "Dad, look here.
Yes.
If I have become a doctor just to earn money, then this profession is not good." I asked him one question. "Tell me a richest lawyer in India." Immediately the answer came, Ram Jetmalani. I said, "Tell me a richest doctor in India."
Yes.
So he was, "Kaun hai, kaun hai?" You will not find richest doctor. Money is not with the doctor.
Yes.
The money is not with the doctor. So
Definitely.
if you want me just to earn, then why should I spend my life as a doctor? I can be with this, my intelligence that I have inherited from you. I would do better in business, in minting money. My younger brother,
Yes.
He also got admission into MBBS. He left in 1 year's time. He said, Dad, I don't want to be a doctor. It is a cumbersome job, and I have learned studying in that college that whole night you have to be awake. I can't disturb my sleep. And what is the earning? I would like to be industrialist. So he said, at least become engineer and then become industrialist. He's an industrialist today. He's a big industrialist. So, the money part was there. But I said, I've seen the richest people not happy having much more money. So what is there is a job satisfaction. When you cure someone and he gets a tears in his eyes and he says, touches your feet, I don't allow them because they come and say, Doctor, you made a heaven in my life. That is a gratification that you get from homeopathic practice. You may not cure all. There might be people who might be unhappy also. But this type of respect I never used to get in allopathy. Respect used to get out of your, Doctor Sahab, namaskar, kaise ho? That is an artificial respect I used to get. Here I used to get a love. People used to bring me different things to eat. Doctor Sahab, aapki tabiyat bahut kaam karte ho. Ghee kha lo, ye गाय का घी खा लो, ये खा. That love and affection I got in homeopathy. And when you do something, people don't mind paying you, provided you give them good results. And you can ask for it, rather than doing wrong practices. And this, instead of that, ask directly. This is my need and I need this. And that is how homeopathy grows. And you show the results, then people are ready to give good fees. And without that, you can't see. Because of when I increased my fees, that time I could set up a very big institute in Goregaon here in Mumbai with all the machineries. I got X-ray machine, ECG machine. I got body function scanner machine, aura scanning machine, which tells me about, because I've gotten now 5th degree of acupuncture. About 6 months back, I got that degree.
Wow.
We passed in the Indian Medical Acupuncture Council that is set by Maharashtra University. And there are magical results. Because, after studying all the sciences, there are limitations. You must have seen me, so many certificates, 117 sciences I learned with just to see how my aim is to hit the eye of the fish like Arjun. कौन से बाण से कर रहा हूँ? My mission is to cure the sick. उसमें I got all many sciences together, but I found homeopathy number one in giving a real help to my patient. Where their limitations come, I use other sciences like frozen shoulder. On the spot, I can see the hand going up if it is not very long. After listening to my talk, so many patients, they come with the high over, hey, doctor sahab to mujhe magic jaisa ठीक कर देंगे. No, I am not a magician. The history has to be good. You have to give proper symptoms. You have to give the real follow-up. There should be no false follow-up given by the patients. Then in homeopathy, you get the best results. So I tell my also younger generation of homeopathy, be proud to be a homeopath and be confident. When you have a mission, if you are taken admission to practice allopathy, no one can help you. But if you are taken admission to become a homeopath, because it's a really good science, go to different doctors. Don't be against anyone. There are different schools of thoughts. Learn everywhere. In Marathi, there is saying, "Aikawe janache karave manache." Listen to everyone, and what appeals to practice that and do that. What suits you. The final aim should be to cure the sick. But don't get dismayed. Go by some clinical tips also till the time you get the result, till the time you achieve the expertise. In the initial period, you may get baffled, you may not get results. So try to practice and see and start treating nearby your ones, and you'll start getting the confidence. But for that, my first advice would be, you should be clinically sound. You must know what you are treating, what disease it is, what clinical symptoms are there, what pathological symptoms are there, and then come to characteristics. Because if you come to characteristics, symptom, and there are 6 remedies, and if you know the pathology, then you can hit the remedy correctly. That is my experience. Otherwise, if 5 remedies are there, 3 you fail, 2 last one is okay, the patient will leave you and then you'll lose the confidence. So if you have a knowledge of clinical medicine, if you have a knowledge of pathology, it is not required for prescription in homeopathy. But if you have that knowledge, it will help you in selecting the correct remedy in a shortest possible time. That's all from me. Any more questions?
Sir, just one thing I want to ask you, that what do you think about, what are your thoughts about integrative medicine? Because recently when COVID happened, then there was a lot of discussion going on of adding homeopathy for advanced care, and especially the critical care. So what are your thoughts about it? Because you have also advised government also how Ayush can be supplemented. So, do you think that this
It
would
will
be a good
not be
idea?
a good
How
idea.
India
It will be
can,
the best
go
idea. Excellent idea, because integration comes, particularly if it comes right in every stage, it will be the excellent part. But I think it is very difficult for other science to accept everything. But at least where doctor come together is where there is no hopes, and that no hopes situation came during COVID time. And there also I started giving 1-2 remedies and not getting the results, and then I made a combination of remedies. If you see my lectures and webinars that I had taken that time, how from pathology to the symptoms you have to take, and what is genus epidemics, it was not a single drug, because pathology was different.
Yes.
Blood vessels were involved. Pneumonia was secondary to vasculitis. So I selected all vascular medicines and then took the vasculitis giving rise to pneumonia, vasculitis giving rise to alveolitis. What are the homeopathic remedies that are there on these different tissues, and what are the presenting symptoms? So I made a list of that. And one, I kept option open. If you are very good in giving individualized remedy, give it as a first, but complement and supplement with these remedies. And students started getting good results. Then I came on web and prescribed everything along with this. Whatever they want to take allopathy, let them take. We cannot stop because it's a calamity law and homeopathy is not allowed. So there everyone was very good and giving, but there was a criticism also of giving so many remedies. I said, we are not mixing the remedy. We are following the principles. We are using complementary follows well remedy. It is space, little lesser space time, so that, we want to supplement the body to overcome the clinical condition. And then in second wave, I didn't give that formula. So one of the doctor raised, sir, this time you are not given the takeaway formula. I said, people criticize, therefore I don't have given this time. Well, no, sir, because of that formula, I must have saved 1,000 patients. So I said, that is good. Then I should give it. Those who want to believe, let them believe. Final aim is to save the people. And that is how, the integration worked there. And second integration was in ICU. In ICU, those who are doctors and their relatives, even COVID hospital owners. One of the owner has given the testimonial I have showed. He is having 3 COVID hospitals in Mumbai. Wow. He's the owner, and he is himself an orthopedician. When he developed COVID, he was given homeopathy and he endorsed. And he said, integrate this. It's my experience. Integrate homeopathy along with allopathy in ICU so that we can save so many lives. He'll openly come and say, I'm not against any science and I am not for any science. But it's my practical experience, which I have experienced. Dr. Jaswant Patil gave me, and he was asking, and I was on steroid but not responding. Fever was not coming down and fever came down fast. And I was discharged and my lung involvement cleared, and 7th day I was working. So,
Wow.
these are the examples. These are the anecdotal examples. But these anecdotal examples are with so many thousands of homeopathy. All they integrate, then we'll get a series of, I think, a minimum of 1 lakh cases. And that if you present to government, then they will believe. Because what Jaswant Patil tells or any other all stalwart homeopaths, they say, everywhere it has been called as anecdotal. Like our task force, we had decided, and Dr. Padma Shri, Dr. T.P. Lahane, he was a chairman of our task force. He's an allopath, he's an ophthalmologist. So he used to interact with me. I said, sir, we must convince the allopathic medical task force to integrate homeopathy. But he said, then you make a presentation in allopathic task force. I said, I'll make a presentation. So I made a presentation of the cases that I've treated in allopathy with 𝐈𝐧𝐬𝐿6 6,000,
Wow.
LDH 12,000, like that cases, those cases. You see how they got well. And this. So one of the doctor in the task force, who is also my colleague in my college, he knows me. He said, Dr. Jaswant, we believe you, but these are all anecdotal stories. Where is the research? We speak of a research, and that is what is lacking. I say I agree with you. That is lacking in homeopathy, and we are working on it now. CCRH and everyone is trying their hard to make homeopathy in a research form, so that till the time we show the research, no one would believe us. And that is how they said, no, you do only for the prevention. I said, okay, we'll do, but at least those patients who want homeopathy, at least allow them.
Yes, willingly.
So we can't take a risk.
True.
I said, you are anyway taking a risk. But this fight, I've fought a lot. I've done. Dr. Lahane sir had also helped us a lot in the task force. He was also promoting Ayurveda, homeopathy. But a lot of resistance is there. I think that resistance from their side is also not wrong, because they have moved into a total modern science, which is based on the research. Why? Anyway, now you see the research based on nimesulide, the best drug. Finally, it was withdrawn from the market because it is causing problems. So one research said this is the best drug. Second research said it is a bad drug. But at least show something that it is good, and then the things will start moving well. So the integration requires first the research to prove our efficacy. It has to be like we do the provings of the drug on a human. Same time we should do changes in the physiology of the body. That proving. Unless and until we work on the module of the modern science, it is not difficult, but it has. We should have a proper setup and mindset to do in that way. Then definitely it will work wonders. And now CCRH has taken up an 𝐸𝐮𝐬𝐻 Delhi in pulmonology department. They have started doing a research on post-COVID cases. And I was called as a monitor there. So even the ICU cases which were done in 𝐸𝐮 as an integration. Khurana sir was there at that time, a chairman. He only invited me, said, you take this. And there we have seen there is an effect, good integration effect. The paper has been presented, but every paper requires to be peer reviewed. Then somewhere, if there is no favorable conditions, all over something or other goes on. But I have seen a good results. Okay. And again, there was a restriction on them. The way I was free to use multiple drugs, they were not free to use those. So the results, you will get a mixed results. That is what happens. And therefore, integration is possible provided we make a lot of hard work at the research level, prove them, see this. Just by my own one single doctor's experience, whether everyone would accept, that is a question mark.
Yes. Yes, thank you so much for sharing this, sir. And of course, that is correct that we should, being homeopaths and being into this fraternity, we should focus on research and whatever we can do to boost the efficiency of homeopathy, that how it can be used and how it can provide the results. So thank you so much for sharing a wonderful journey you had so far, and so many gems which you said people are really liking, and they're also asking you that if they want to join you or if they want to learn
Yeah,
from you,
that's a
how
very
can they
good
do it?
question. I'm thinking of starting an academy where, but
Wow.
somehow I do not know why that is not happening, because I need some team, and I'm
Mhm.
gathering. I got so many occupied things,
Mhm.
what to do. This. The main aim is the core
Yes.
competence is treating the patients. I'm treating from 13
Yes.
countries and all over India. So my time goes from morning till night.
Yes.
Now Sundays I have kept it very.
Yes.
Thursdays and Sundays I have stopped my practice, because I on Thursdays at least I have to give some time, but some other work, this work, that work, and this, it is getting pending. But shortly I'm planning, till the time I get a very good team.
Surely, and there also, yes, yes, that would
Yeah,
be
I
wonderful,
want
sir.
to
That would be
concentrate
really
on clinical.
beneficial
See,
for all of us.
allopathic science is the best science, knowledge and everything, and integration and everything has to be done properly. Otherwise, then we can show our efficacy. For that, we have to be very sound clinically. You know how we were taught
Yes.
uh, in MBBS time. Our boss is to come. Hmm?
Mm-hmm.
First is you should be well dressed. Doctor has to be well dressed. If the
Mm-hmm.
tie is longer
Mm-hmm.
than your belt where it is attached, you used to cut with the scissors. If your shoes are not
Okay.
polished, you used to throw away in the dustbin. You go without shoes. If the stethoscope should be only 1 feet long, not that long, हाथी के सूंड जैसा नहीं, used to cut with scissors. So we came to know the basic training. Then we used to put 6 cases, auscultate here and write
Mm-hmm.
down your findings. Everyone, come and auscultate here. Only one spot where you used to know if there is a cavity. So how will be the respiratory sounds? Then he used to say, see, four are right, four are wrong. Now he used to catch who are wrong, why they are wrong, not scold them
Mm-hmm.
or not put them down.
Mm-hmm.
Where they made a mistake and how to
Mm-hmm.
correct the mistake. Therefore, allopaths
Yes.
are very well trained. If you see their confidence and everything,
Yes.
that is because of the training, the practical training. And that is how
Yes.
the teaching was.
True.
And you auscultate. There were cases also to explain. So this training I would like to do for my academy, where if I ever start with the clinical experience has to be the first, just
Yes.
not the lectures. The clinical is very very important, so that you start putting a stethoscope and first seeing. Nowadays stethoscope is not needed because sonography, x-ray, chest test come, but at least primary things you should know, because every patient we cannot send for investigation at the start of your practice. When you achieve a good upliftment in your practice, that time you can advise number of tests. There is no problem, but here clinically you should be sound. That is what is my mission.
Yes.
But take a good part of allopathy,
Yes.
good
That's
part of
that's
homeopathy, and integrate. That would be the best solution to the world. That's a final thing that I would like to say. If that happens, the world will be healthy and people will not die so soon and prematurely. Thank you.
great, great. That is
Thank
amazing,
you.
sir. Thank you so very much for your precious time that you have spent with us. We are really, really grateful to you for sharing your experiences here, in spite of being
Thank you.
unwell. So thank you so much, and would like to see you in person. So whenever we would come in Mumbai, we would like to see you. That would be a
Yeah.
great, thing for us, because I would be
Sure,
meeting you
sure.
after
You're
so
welcome,
many
and I'm
years.
always there. And definitely, if something has to be
Yes.
done for homeopathy, it is good. In the first wave, arsenic album was distributed. But I used to always say, don't say it is 100%. There is always a limitations because no science is 100%. But maximum, even if you get 70% protection. Now, what does the vaccination do? They don't give you 100% protection. But at least they give you. Now, first wave, second wave, third wave, I didn't get anything. My wife got once, and she had an 8% lung involvement. It was a difficult time for me, but she got cured with homeopathy in 3 days' time. And with that, we had quarantine. We didn't, that time it was anyway strict quarantine outside also. So there was no question of going out. But I learned one thing, and that today is a very good show. So many, I think, non-homeopaths must also be seeing. And one thing that I learned, that even if you use homeopathy for the protection, but if your emotions get disturbed, your immunity goes down, and you catch the infection. Because she caught the infection, and 7 days back, she got angry on one person. I said, your mind is disturbed. No, I'm not disturbed. She didn't take a medicine. She didn't take a medicine. And I was expecting she may get. But I said, we are staying all quarantine. No, from मच्छर भी नहीं अंदर आ पा रहा तो virus कहाँ से आएगा? No one, we are not going out, we are not taking outside food and everything. Nothing was there. So it was so strict separation. Still she got it. I said, how did it happen? So that means the virus has got entry inside the house. Then why only she got it?
Very true. Very
why she got it?
Nice
question. Why we all didn't get it? So one thing was that she was not, arsenic album should have been repeated. She was not very keen on repeating. She says, I don't want many medicines. But second, even that is not a question. Second question came to me, that was she disturbed? Was she disturbed? Yes, she was disturbed. And that gave her a problem. She was managed by my daughter. She said, Papa, you don't come in and see. I said, it's very difficult for me not to attend her. If anything has to happen, it will happen now. It's destiny. We cannot run away from and we cannot get frightened. So at least I have to come, auscultate and see what is happening, what homeopathic remedies I am giving, whether they are working or not working. So she said, I will be with her. And she is non-medical, but she knows medicine after learning from me. But she is not so cautious. So she was giving the medicine. She was sleeping next to her in the room where she got infected. She got only 1 day fever and she got well. And because she was afraid for her health, mother's health. As a husband, I was also worried and afraid for her health. At the same time, I thought, if I develop a COVID and I go into that state and I have to manage myself, it would be a difficult job. So there was a fear of infectious disease, fear the fatal disease will end. So 3 o'clock I got up, sat on my radar and just repertorized my own symptoms. And the remedy came arnica. Arnica remedy came.
Wow.
I took that arnica dose and it gave me a great relief from the fear and everything. And that was the reason I didn't get it, even though I was examining her. Without PP suit and all those nothing. So that gave me one clear-cut clearance in my mind that if you are emotionally disturbed, you will be caught. You become a rat, cat will catch you.
Yes. So same thing happened with many COVID patients I have also experienced. If they were very frightened or their morale was down and they were not confident of the recovery, their recovery was very difficult. and those who had very severe disease,
Correct.
and if they were hopeful, they had more hope, the recovery was easy in spite of having very severe pathology. So I've seen in ICU also some patients were like कि हो जाऊंगा मैं ठीक, don't worry, I will come out of it. And if you give them like medicine, it was like hope really helps, and also that that helps us to
And homeopathic medicines gives you hope, the courage to get that, and therefore homeopathic remedies were my every patient on in ICU and COVID. My first prescription in the list was Aconite. Extreme fear of death, and that has helped many patients. You don't have to ask the patient, are you afraid of that? He will be afraid when the whole world is afraid. Why he cannot be afraid? When you have gone into a problems, that means you were afraid. The cytokine storm used to come because of fear.
Yes. Yes.
Yeah.
Very true.
When my oxygen went down this time, last 2 days back, to 90, and sometimes it used to come 89 and 90. That time, that fear came to me in my mind. I'm giving my story because I what I experienced, and then I realized what patient must have experienced that time. That when it came down, so I immediately took opium 10 Opium is my medicine, so I took that. And in a matter of say 3 minutes, I slept, and my fever came down. After tuberculin, it was started coming down, but I saw that even in that I was, my God, what is happening? God knows. And I've seen so many homeopaths also losing life. So it was a real fear. But you know, the combination of medicines worked with me. Because I had seen that happening to me, and I didn't. Whatever is not giving relief within, say, 15 minutes time, 20 minutes time, don't waste time. Act fast, act wise, and dare to be wise. That is what Dr. Hahnemann has said. There are a lot of things to discuss. Time is a constraint for us. We should be short, and we can regularly start doing all these teachings to our students. That time I would cover more. Live shows we can do for public what is there and what they should do to prevent themselves from the disease. Thank you so much.
Thank you. Thank you so much, sir. I'm so grateful. Thank you. And you are an inspiration. Thank you. Keep inspiring us. Thanks a lot, sir. And thank you, guys. Thanks to all of you for joining this live session. Please feel free to send us your feedback, your comments, whatever you want to say. You can just write down in the comment box. Thank you so much. Happy World Homeopathy Day to everyone. And we will come up with many such sessions in the future. Thank you so much for joining, and good night. Good night, sir. Thank you. Yes. So thank you so much, everyone, for joining in. It was a wonderful session with Dr. Jaswant Patil, and he's a living legend. He has worked very, very hard, and the way he takes the case, the way he handles patients, and the way he spoke today, you must have got an idea about how passionate homeopath and how passionate physician he is. You know, he just wants to do best for his patients, and he's a true believer of holistic medicine, because he not only practices homeopathy, he is learning acupuncture. He does that. He is a practitioner of Reiki. He integrates a lot of techniques. So we all should learn that one quality from him. That is the ultimate quality which I always try to imbibe from such personalities is readiness to learn new things, and readiness to include those things in your practice so that you improve your results. So we have all the time to be into controversy or discuss what can happen, what happened, and all those things. And we have all the time to develop ourselves, update ourselves, to become better versions of ourselves. So I would recommend, the second one to everyone, and I try to practice that. I also want to thank Dr. Vaibhav for starting this series and for providing me this platform to talk to all of you and to talk to such personalities. Thank you so much, Dr. Vaibhav. Thank you so much, everyone who have joined here, and all those who will be watching this video later. Please do share about this video, about this series, with all your homeopathic colleagues. And along with that, I want to tell you one thing, is that very soon, like sir said, that we have to focus on clinical medicine. We have to focus on clinical understanding of diseases. So we are bringing therapeutics course, which is completely a clinical course. We are not going to talk about any theory in that course, which, because we have curated this for all such homeopaths who want to gain clinical knowledge about remedies, about investigation, about diagnosis, about all such things. So that course is going to start on 22nd of April, every Friday, Saturday from 22nd. So it would be on Friday, Saturday, 7 to 9 p.m. And I'm going to invite many clinicians who have huge experience. Some have 25 years of experience, some have 15 years of experience into homeopathy, and they are real good clinicians who are very dedicated to bring good results. I would urge every one of you to please join that course. Also, next Sunday on 17th April, we are going to do a masterclass on therapeutics course, which is free, but we have limited seats. So if you want to join that class, if you want to get a glimpse of what is that course and how we are going to teach, and if you want to meet the speakers of this course, few of them will join. So please join this masterclass. We would be putting a link to join that. If you are interested, just let us know. Just DM us to join this masterclass on therapeutics. This is a free event which is happening next week. Thank you so much for joining in. And if you have any questions, suggestions, anything for Homeopathy Junction, we are ready to incorporate that. Thank you so much. Have a great time. Good night.